The top 10 causes of death in the world. Many people die every day. What caused their death? How did the causes of death change over time and differ between different countries and world regions? And what are the risk factors that lead to an early death? Stay tuned to find out the top 10 causes of death in the world. Number 1. Road accidents. Tragically, as many as 1.3 million deaths are a result of road accidents every year. It is the leading cause of accidental death. Road accidents often lead to death as the impact of a collision can cause severe injuries such as head trauma, brain swelling, hemorrhages, and blood clots, external and/or internal bleeding, or a broken neck. It's the leading cause of death among those aged 15 to 30, with 90% of cases occurring in developing countries, and a further 20 to 50 million people a year suffer vehicular-related injuries, including disability. In the last 30 years, survival rates for road accidents have doubled. This is partly thanks to safer vehicles but also due to improvements in medical devices for diagnostics, treating wounds, and replacing failed organs. Number 2. Tuberculosis. Tuberculosis was one of the most prevalent global epidemics in the 18th and 19th centuries. Since a cure for TB was discovered by Selman Waksman in 1943, the number of TB-related deaths declined significantly in the years following. The widespread distribution of the TB vaccine, BCG, helped to reduce cases further, although it has not been entirely effective in preventing the disease. In fact, TB remains a significant threat as one of the top 10 killers in the world. 1/3 of the world's population is infected with TB bacteria every year, causing over 9 million cases and resulting in around 1.4 million deaths. Number 3. Diarrheal diseases. Diarrheal diseases, including cholera and dysentery, are another leading cause of mortality, particularly in developing countries. It is the second leading cause of death in children under 5 years, killing approximately 525,000 children every year. Prolonged bouts of diarrhea strip the person of water and vital electrolytes such as sodium and chloride, leading to fatal levels of dehydration and malnutrition. These diseases are predominantly caused by drinking unclean water and/or living in unsanitary conditions but can be easily treated with medication. However, insufficient availability of these life-saving drugs in many developing countries makes it difficult to control the widespread outbreaks, leading to 1.39 million deaths a year. Number 4. Alzheimer's disease. The number of people dying from Alzheimer's disease, the leading cause of dementia, is rapidly increasing every year, 1.54 million. Alzheimer's is neurodegenerative disease in which patients experience a gradual decrease in cognitive ability, such as memory and speech, caused by a buildup of amyloid proteins. Currently, there is no known way to prevent or cure Alzheimer's disease. Number 5. Diabetes. There is a growing global epidemic of diabetes that affects over 400 million people, resulting in approximately 1.59 million deaths each year. There are two types of the disease. One is an autoimmune condition whilst the other is linked to poor lifestyle choices such as diet. In both cases, the body has difficulty dealing with insulin, an agent that helps the body to absorb and process glucose. Number 6. Lung cancer, trachea and bronchus. Lung disease, particularly lung cancer, is of the top 10 killers. It is responsible for over 1.6 million deaths worldwide. Lung cancer is a particularly aggressive and serious form of cancer that is very common in smokers, accounting for 85% of cases. Countries such as Spain and Hungary are highly affected by the disease, and in China, it is the most common type of cancer. Number 7. Chronic obstructive pulmonary disease, COPD. Another one of the most common causes of death globally is a cluster of airway conditions that fall under the term chronic obstructive pulmonary disease. These include chronic bronchitis and emphysema, which are conditions that make the lungs inflamed and damaged. The main cause is smoking, although COPD can affect non-smokers, particularly asthma patients and those who live in very polluted areas. Asian populations are most affected because of high levels of pollution in countries such as Nepal, North Korea, and India. COPD is estimated to be the cause of 3.17 million deaths every year. Number 8. Lower respiratory infections. Lower respiratory infections are the deadliest communicable diseases in the world, which are triggered by viruses and bacteria. These diseases affect the patient's lungs and airways. Examples include influenza, the flu, bronchitis, and pneumonia. Global flu epidemics and pneumonia are known to cause devastation in elderly and infant populations every year. In 2015, pneumonia killed 920,136 children under the age of 5, mostly in South Asia and sub-Saharan Africa. The introduction of vaccines has been incredibly effective in lowering mortality rates over the past 20 to 30 years, particularly in developing countries. Number 9. Stroke. The second leading cause of death worldwide is stroke. A stroke occurs when the blood supply to the brain is disrupted, causing brain cells to die. This can lead to brain injury, disability, and in some cases, death. The main causes of a stroke are a blockage, blood clot, ischemic, or a ruptured blood vessel, hemorrhagic. Most prevalent in developing countries in Southeast Asia and the Caribbean, strokes account for 6.24 million deaths per year. In early 2017, it was announced that a promising treatment for strokes is being made more widely available to patients: mechanical thrombectomy. Number 10. Ischemic heart disease, coronary artery disease. Topping the list of the world's most deadly diseases is ischemic heart disease, more commonly known as coronary artery disease. Responsible for nearly 9 million deaths every year, heart disease is caused by a buildup of fatty deposits on the wall of the arteries, usually attributed to lifestyle choices or other conditions such as high blood pressure or diabetes. This disease is deadly as the patient's arteries become narrowed, restricting blood and oxygen flow to the heart, potentially leading to a fatal heart attack. Non-deadly attacks cause chest pain known as angina, which can proceed to a heart attack. Eastern European countries such as Ukraine, Uzbekistan, and Kyrgyzstan suffer the highest number of casualties, most likely due to the heavy drinking culture and high levels of pollution. Thank you for watching the video. We do hope you enjoyed and learned something. If you found value in this content, give us a thumbs up and subscribe for more. Have a great day, and see you in the next one.